Welcome to the Modern Titus to Women Unplugged podcast, where we dive fearlessly into the untold stories and struggles of women's lives. This is a space of authenticity where no topic is off limits. Each episode is a journey of discovery and empowerment, confronting challenges with honesty and vulnerability. From maintaining a home to healing from abuse, balancing motherhood with personal passions, and navigating single parenting, widowhood, divorce, and post-abortion heartbreak, we explore it all. With special guests offering wisdom and perspective, we uncover forgiveness and reignite love in marriage. Join us for soul-stirring conversations. Tune in. Your story matters.
This podcast is for informational purposes only and should not be considered legal, health, tax, professional advice. We are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast. The podcast is not intended to replace professional medical advice. The views expressed in this podcast may not be those of the host or management. The podcast may contain adult themes, so therefore parental discretion is advised. Welcome to the Modern Titus to Women Unplugged podcast. Our podcast is one where we fearlessly dive into unspoken struggles that shape the lives of women today. As part of our mentoring role, we seek resources and support designed to help women thrive. We explore strategies for achieving optimal well-being and performance in every aspect of life. Today we have as our special guest, Marie Hoag, and she's a clinical hormone coach with over 20 years specializing in perimenopausal and menopausal prevention and reversal. Yes, I said reversal. And positions hormone replacement therapy training and also for hormone coach training. So without further ado, we have so much questions and so many things to go to. So I'm just going to hand it over to you. I'm going to ask you to expound on your credentials to let people know, what the skill sets and that they have somebody who really knows about the topic talking to them today. So you can go ahead for me, please. Thank you.
Hello, Lorna, and thanks so much for having me on your show. I'm Marie Hoag, and I've been working in the female hormone medicine industry for a little over 20 years. And I have an extensive background in female hormone medicine and anti-aging medicine. Though I'm not a physician, I have attended thousands of hours of medical education in anti-aging and functional medicine, along with my colleagues. I'm a menopause coach, perimenopause coach, menstrual cycle coach, transformation life coach. These are all the things or skills that I've developed and certifications over the years that has led me to where I am today. But mostly I talk about my experiences, not only as a woman on hormone therapies and all different types of hormone therapies over the years, but mostly as somebody who has worked in a hormone clinic with all forms of hormone replacement therapy, helping women get their hormones balanced. And based off of my experiences, I've noticed the changes that take place in women, and I started to track those changes systematically with monitoring how women feel, with clinical assessments as well as blood work. And that's why I started a research foundation, because of the findings over the years. So my background is pretty extensive, and though I call myself a clinical hormone coach, there's really no real certification for that. It's just what I actually ended up doing in the clinic, because women tend to have a tough time on hormone therapy, especially advanced therapeutic dose HRT protocols. There's a technique and a process to getting to hormonal balance, and women really need their hands held through that process because many changes take place to the brain and body of a woman during that time.
Right, right. So when I told some of the ladies that you were coming and that you were going to talk about prevention and reversal, they said reversal. How can you reverse perimenopause? Oh, can you reverse menopause? So if you want to expound on that a little for us, and give us another question was that they wanted to know if it's when it's reversed, you get back a cycle, and if the prevention aspect of it is that you continue to have a cycle. So if we can, answer those two questions to me for them.
Yeah. Menopause prevention and reversal. Yeah, it's a controversial topic, but first you have to identify what menopause is.
Mm-hmm.
And menopause really is the 1-year anniversary of not having a period. It's a 1 day in time, and then the stages after that anniversary, there are 4 stages of postmenopause. And the menopause is the cessation when the period stops. That's what meno is, menses, and pause is the period
Mm-hmm.
stops.
Mm-hmm.
That's what menopause is. Menopause isn't something women wallow in. It's not a condition. It's just an anniversary. And women lose their periods and they have period problems when they don't produce enough of the 2 main hormones that regulate the periods, estrogen and progesterone. So what happens is the ovaries, either the signaling to the ovaries or the ovaries are so unhealthy that women stop producing estrogen and progesterone, so the periods stop. So the 2 main sex hormones that are responsible for regulating a healthy menstrual cycle and a regular period is estrogen and progesterone. So what I've come to notice over the years, and what I did with myself and thousands of other women have done it as well, is if you can restore these 2 hormones, estrogen and progesterone, that mimic women when they were healthy, in their healthy reproductive prime, then it allows the body to regulate itself. It allows the uterus to start working again, and it regulates a healthy menstrual cycle. So a woman can have a regular period if she still has a uterus, if her uterus is healthy enough. So the goal and what I did for myself was I restored my estrogen and progesterone that mimicked myself when I was in actually, I had never had healthy levels of estrogen. I had never had a healthy period that wasn't accompanied by severe PMS, PMDD, headaches, migraines, pelvic inflammation, cramps, mood swings, anger. And those are all because I come to find out I was hormonally deficient. Mm-hmm. So what I did was restore those 2 hormones, estrogen and progesterone, and it gave me my menstrual cycle back. Mm-hmm. But it did not give me PMS, PMDD, or any of the side effects that I had when I was younger, when my hormones were low. So for the first time in my life, mm-hmm. 50s, when I brought back my menstrual cycle, I didn't have the side effects that most young women experience with their menstrual cycle. And we know that now it's because their hormones, or their estrogen and progesterone, are too low. So I'm not sure if I was clear with that, but basically I restored the hormones that regulate a healthy menstrual cycle. And because of that, I got a menstrual cycle and a period back.
So ovulation is taking place. Can somebody get pregnant? I mean, it's kind of 60-year-old or 65-year-old woman doing this reverse. I'm just saying.
I know. Once a woman is born with a certain amount of eggs at birth, and they slowly get eliminated out of the body. And once a woman is out of eggs, she's out of eggs. So no, she's not able to ovulate. But mm-hmm. those are different things. So you can have a menstrual cycle and even a period without ovulation. Mm-hmm. And that's what ends up happening is women, well, when you fully restore hormones the right way, it acts as a type of birth control pill because it does prevent a woman from ovulating. So even if she does have eggs, the hormones are restored in a way that it doesn't allow her to ovulate. So it's more as a type of birth control. That's why we recommend women who want to reverse perimenopause or menopause to be sure that they don't want any more children. And this is really the best time for women to get on a therapeutic rhythmic HRT protocol.
Okay. What are the common misconceptions that women have about menopause and perimenopause? What's some of the common misconception?
I'd have to say the biggest misconception is that they have to experience it. You know, women think that, oh, well, I'm going to go into perimenopause or I'm going to go into menopause. No, you don't actually have to. Menopause happens, you know, about 10 to 15 years prior to the period stopping, the menopause, the 1 year anniversary of not having. The 15 years leading up to that is the transitional time when the ovaries are producing less and less progesterone and estrogen and progesterone that regulate the menstrual cycle. So the perimenopause really is a time that tells a woman that her hormones are in decline. And this is the time to restore the hormones to healthy levels so she doesn't have to experience this transitional process. Because that's during this time, women, not only do they experience irregular menstrual cycles, they're experiencing a lot of other mental issues and physical decline of the body falling apart, the processes of the body falling apart, as well as the menstrual cycle. So women will experience depression, anxiety, insomnia, joint pain, lack of libido, low energy. They gain weight. They can't lose that weight. They have mood swings. Nobody wants to be around them. Well, this isn't caused by perimenopause. Perimenopause is caused by the same thing that causes these things, and that's hormone deficiency, mostly estrogen. So restore estrogen back to healthy levels, there is no perimenopause and there is no menopause. And women can restore her estrogen and her progesterone to levels that mimic a young, healthy woman so she doesn't have to experience perimenopause or menopause. So the biggest misconception with perimenopause and menopause is that that women have to experience it, but that's just not the case.
But I can speak about my experience, because normally when you go to the doctor and you have mine was severe heat. I was sitting here and all of a sudden I feel like somebody opened a big oven and a flood of heat. And as quickly as it comes, it's as quickly as it goes. But I'm all wet, sitting at night. And when you go to the doctor, they say, well, this is part of the change of life, and, give you little things to take, but nothing serious to really help you. So that is one of the things, experience as women.
Yes, because conventional medicine physicians don't address hot flashes at the root cause. So when I tell you that in perimenopause and reaching towards menopause, the regulatory systems of the body break down and malfunction. And estrogen dictates this process. So when estrogen gets low, it affects the body temperature control in women. It also affects the cardiovascular system and the heart palpitations and the side effects that women get when estrogen is low.
Right.
So are brought on by estrogen deficiency. Women who fully restore their estrogen don't get hot flashes. In fact, that's one of the clinical indicators that we know if estrogen is low. So conventional physicians, they're not taught in medical school to say, oh, well, you have hot flashes because you're estrogen deficient. Let me restore your estrogen and you'll never have another hot flash. And so what they're trained to do is disease management. It's the disease management model of, here, let me give you these psychotropic drugs and make you a and so you don't keep coming back to me to complain about your hot flashes that I don't know what to do.
Right.
Difference in going to a doctor who's trained to know, well, hot flashes are an estrogen deficiency side effect. It's one of the many things that women experience that they don't have to, that actually women can control if they go to a doctor who knows how to fully restore their estrogen, not just mask the symptoms with low dose hormone protocols. So that's one of the ways that we know that women have enough estrogen if they still have hot flashes. it's one of the things that we monitor. So if a woman has a hot flash, it's a sure sign that her estrogen is low. And I say this with confidence because when women finally get enough estrogen, there is no hot flash. I used to have flashes all the time. And yeah, they are miserable. And I too went to the doctor, and the doctor says, oh, here, take this antidepressant, this anti-anxiety. And it's like, well, wait, but what about my hot flashes? Well, this will just get you through the hot flashes. And it wasn't until I fully restored my estrogen that I found out I never have another hot flash. And the only time I get hot flashes is when my estrogen drops too low. So to me, I do the math. It's like, okay, well, if I maintain my estrogen in this optimal reference range, I don't have hot flashes. Whenever it falls out of the optimum range, I get hot flashes. Well, it doesn't take scientists to do the math on that. And this is why women need to understand their own bodies. Why are they having these symptoms? Why are they experiencing hot flashes? Well, they experience hot flashes because their estrogen is low. You restore the estrogen, there's no more hot flash. And this is why I think it's important to do shows like what you're doing, so women can have a better understanding that they can actually control over how their brains and bodies are deteriorating.
The hormone coach training, who do you primarily train? Is it persons in the healthcare sector? Is it doctors? Is it nurses? Who are your main
Yeah, usually I don't really recommend, though anybody can. Well, usually health coaches who have some sort of nutritional background, dietitian, nurse, mental health practitioners, healthcare practitioners. Janice, if you have a medical background or a wellness or fitness background, really understand a functional medicine background, I train as clinical hormone coaches, because part of the education is our facility trains these practitioners the best diets that we've seen work that allow hormone replacement therapy to work better. There are some diets that don't allow the hormone therapy to work very well, and there's diets that do. And so, but I don't recommend doctors to, even though I do, in a way I do. In fact, the doctors do go through the health coach training, but their job really, when I train physicians, is how to write prescriptions for therapeutic rhythmic. It's just not cost effective for them to act as the coach. But I do train the doctor to work with the clinical hormone coaches that I train, because everybody's on the same page with the destination. Because hormone replacement therapy isn't just a crapshoot where you just, oh, here, take this, and it's not, they make this. Now, getting hormones properly balanced is a clinical destination. And I teach both the physician and the hormone coach what that destination is and what each position is in achieving. So there is this relationship between the hormone prescribing physician, the clinical hormone coach, and the patient. And the three work together to meet a certain clinical destination of optimal hormonal balance.
You said that our diet has an impact on the really?
Oh, you bet it does. In fact, I ignored this for a long time because I didn't want to change my own diet. I had a horrible diet. And when we're first really starting to get into therapeutic HRT protocols for women about 15 years ago, we were trying to figure out why we were giving the same hormone replacement therapy system to different women, but we found that women didn't respond the same way. We had to figure out why. And then because I started to monitor clinical indicators along with blood work, started to figure out, okay, well, why are these women doing real well? What are they doing in their life? What is their clinical criteria? What is up with these women? And why are these women doing so poorly? So over time, I realized it was the diets that they were eating. That's how we found out what diets work best. So women who did real well ate a farm-to-table diet. They incorporated animal meats and animal fats into their diet. women who were ate more vegan diets or who had gut dysbiosis, they didn't do as well on the hormone therapy. They were constantly struggling. They were either flushing estrogen out of their system, and I equate that to leaving your windows open in August in the summertime and running your air conditioner. It's like you can't give a patient estrogen and have her eat a diet that's going to flush all the estrogen out of her system. It's like doing nothing at all.
Okay, that's interesting.
Yeah, we really had to pay attention, but yeah, it wasn't until I incorporated the animal meats, clean meats, and animal fats into my diet that really allowed the hormones to work real well. And then we started putting patients on those diets and found, oh, well, patients had a better clinical result if they ate these. So there's about a half a dozen diets that work real well with therapeutic rhythmic HRT protocols. The low dose hormone replacement therapy that most physicians do now, they tend to push a lot of the detoxification of estrogen out of the system. And that's why women are on this constant state of trying to find hormonal balance, and they're not really reaching destination of balance.
So you spoke about that the therapy or the process that they go to is individualized. I won't get the same thing as another sister or another woman. Is there based on what do you do? Just at a very high level, give us an idea what is done if I come in, what would you do to me?
Well, there's a certain reference range that we're shooting for. That's what most women do well when estrogen is blood serum estrogen is maintained in the 350 to 550 range. Prescribe low dose hormone therapy freak out about this number, but they've never seen for themselves in a clinic what happens to women when you give them enough. And so though most women do well in that range, what's individual is the HRT system that's prescribed to achieve those levels. So yes, it's individual, but most women do well on a particular HRT protocol to achieve. And some women they don't need to get as high as those levels to achieve that hormone sweet spot. And some women need a little bit more to achieve it. But for the most part, 80% of women do best when their estrogen's maintained in the 350, 550 range. What I teach physicians to do is to choose an HRT system, whether it's a transdermal cream, an injection, an oral, but not for estrogen, and to decide which HRT system is going to yield those results. And then there's a titration adaptation process over time where the doctor starts the patient off on a particular dose, and then there's dosing adjustments along the way over this trajectory to the hormone sweet spot. So yes, there's a plan, but it's individualized to the patient, not only with hormone replacement therapy, but with diet, supportive supplements, lifestyle. So all these things work together. It's not just hormones, it's what women are eating. But I do want to interject with diet. When women are estrogen deficient, they crave sugar. They crave simple carbohydrates. It's very difficult for estrogen deficient women to eat a healthy diet. They try and try and try, and they think it's about willpower, and it's not. Estrogen is really responsible for simple carbohydrate cravings and sugar cravings and the health of the gut microbiome. So when you give women therapeutic dose hormone replacement therapy, it wipes out the carbohydrate cravings. It wipes out the sugar craving, simple carbohydrate cravings. So it allows her to eat a healthier diet. And then when she does make these dietary changes and lifestyle changes, she gets a better impact, not only on her health and on her weight and her body composition, but it allows the hormones to work better. They all work together. And it's just one of the things that I've discovered over the years in the clinic. It's like, why are these women doing better? Why are these not? Then I'm going to put these women on this diet. Oh, guess what? They're now in the same category as these women who are doing well. So it really does take a keen eye in the clinic working with therapeutic dose HRT protocols to see the impact that hormones have on the brain and body of a woman. And it is quite fascinating. It's why I'm so passionate about this, because you can't deny what you see as a clinician, and this is what I encourage physicians to think outside of the hormone replacement therapy
Mm-hmm.
box. Women enough hormones, not just a minuscule low dose patch therapy that stops working in 3 to 9 months.
So the other question I had was to ask you about some of the success, if you could share some of the success that you've had or you've seen with persons actually using the therapy and all that you
Yes,
give.
I tell you, the reason I started the business that I have, the research foundation with Panacea Sciences, is because what I've seen in the clinic using different types of hormone replacement therapies. And I use my story because there's a lot of women, and you can interject any woman, and her name is Karen, I usually use her because we have very similar stories, and it's easier for me to talk very passionately about this. But most women, when they come to see us in the hormone clinic, they feel horrible. And Karen came in, and I really related to her because we had similar experiences. But she was a 32-year-old woman who had 2 small children under 3, like me. And she too went to her doctor, who was complaining about severe depression and mood swings and the lack of patience to be around her children and not liking her husband and wanted a divorce, but she loved him and she couldn't figure out why she wasn't happy.
Mm-hmm.
And when we checked her blood levels, her estrogen was in the double digits and she had no traceable amounts of progesterone. So I started to monitor her clinical indicators. She had mood swings. She had menstrual migraines, and she also had chronic headaches every day.
Mm-hmm.
She had a hard time getting out of bed, and she had a difficult time taking care of her babies, and she would just try to feed them something that she knew that they would eat that she knew wasn't healthy, but she didn't want to tolerate the behavior
Right.
eating a healthy diet. So her daily decisions are really based off of her moods, her mood swings. Her husband didn't know what he was going to get when he came home from work. If she was able to make any supper at all, it was very quick and she was back into bed. Everything revolved around her getting back into bed because she just couldn't cope. She couldn't cope with her children. She couldn't cope with her husband. And she couldn't figure out why she was so depressed all the time. Nothing made her happy. And her husband worked very hard to try to make her happy, whether it was a car, a vacation, a house. It just didn't work.
Mm-hmm.
And she would go to the doctor, and the doctor told her, listen, I can put you on these, and let me increase your antidepressant, or this antidepressant isn't working. Let me just switch your antidepressant.
Wow.
Let me put you on this. She was diagnosed with bipolar disorder. She was diagnosed with severe depression, anxiety, insomnia, low energy. She was pre-diabetic. So her cholesterol was high, and she was in her early 30s.
No.
So it wasn't until she got on she went to a doctor that finally said, listen, and the same thing with me. My doctor told me, you don't have a Prozac deficiency. You have estrogen deficiency.
Mm-hmm.
My job is to give you enough of the right hormones so that you don't have depression anymore, so that your cholesterol gets worked out, so your diabetes goes away. So it's the mindset and the training of the physician that Karen experienced, and she was a patient of ours. So I know a lot about her, and I related so much to her. And this was my story as well. It wasn't until I was taken off of these birth control pills that I was told that would make me feel better. But in reality, it put me in chemical menopause. So when women get like myself and like Karen, when women are put on therapeutic dose estrogen, enough estrogen, not these low dose patches, because they stop working, because the brains and bodies of women need more than what these low dose therapies provide. because women go back into feeling horrible. It's like, I'm on hormones. Why do I feel bad again? I felt good when I started them. Why do I feel so horrible now? Well, women feel horrible because their brains and bodies require more estrogen than what these protocols provide. This is how we found out what the right dose is for women. When you put women on a low dose therapy and they're coming back for more estrogen, we call that estrogen hunger. And then so you slowly give a woman more and more estrogen till when she comes back into the office, she's not asking for more estrogen. Her brain, they have enough. There's no more depression. So in care, there's no more depression. There's no more bipolar disorder. Her doctor is like, what's happening to you? You don't on these medications. And she says, well, I got on hormone therapy. I got on therapy. And the doctor's like, well, I had you on hormone therapy. And she says, you had me on the low dose patch. I needed more than what, well, you can't take more than the patch. You're going to get cancer. And then Karen asked the same question I asked my doctor. Well, how many patients do you know that have gotten cancer from estrogen? And the doctor wouldn't answer her because there's no answer. There's no woman who has gotten cancer from estrogen. And so there's been this big scare. And so now Karen is going on 10 years now of on therapeutic dose. And there's a difference between patch therapy and therapeutic rhythmic protocols. And that's what I've been on. So I haven't been on a psychotropic drug since I started therapeutic dose protocols. And so what happens is when a woman gets on the right amount of estrogen and progesterone, it regulates the processes of the body, like the menstrual cycle, the digestive system. The brain starts working. The synapses in the brain starts working. So the depression goes away. The bipolar disorder goes away. The anxiety goes away. That's how we know when women have enough hormones, and especially estrogen, because they don't have these conditions anymore. So I haven't been on these drugs since if I maintain my estrogen in the 350 to 550 range, I don't have mental illness diagnoses, nor do the thousands of other women who maintain their hormones in this range. And that's the reason why I talk about this, is because women have more control over how their brains and bodies function and age than we've ever been led to believe. And so this is why it's important for women to educate themselves. And my hot flashes, my depression, my anxiety, my inability to lose weight, is that an estrogen deficiency? Are those estrogen deficiency side effects? Well, we don't know until you find out. And so my encouragement is for women, listen, don't just swallow the pill. Find out what's really going on with you. And are these side effects, estrogen deficiency side effects and other hormone deficiency side effects? For most women, it is. I'd have to say about for 80 to 85% of the women, yeah, it probably is.
I have a question in regard to persons who have pre-existing conditions, like persons who have heart issues. Can they take these hormones and all this rest of stuff?
There's a lot of data in the National Library of Medicine that talks about how estrogen influences the cardiovascular system. Women with plenty of estrogen have strong hearts and strong cardiovascular systems. One of the reasons women get heart palpitations when they get older is because every muscle and every organ in the female body starts to deteriorate, including an atrophy, including the heart. Estrogen declines, the muscles atrophy, the vagina shrivels up, the tissues shrivel up, as does the heart. And when the heart is in distress and the cardiovascular system is compromised, then there's blood pressure problems and there's cardiovascular issues, and women will get heart palpitations because the heart's in distress. When we get enough of the right estrogen, the body wants to rebuild itself. The muscle comes back, the circulatory system comes back, the energy comes back, the brain, the heart works better. The hot flashes go away. The heart palpitations go away. The only time women tend to get heart palpitations is when their estrogen is low. You restore estrogen, the heart rebuilds, the cardiovascular system rebuilds, the circulatory system rebuilds. So for us, working in the clinic, when a woman is complaining about heart palpitations, we know her estrogen is low, because women with enough estrogen don't get heart palpitations because the heart isn't in distress any longer. Tone comes back, which increases the energy and increases metabolism and allows women to lose weight. So really the question is, how does estrogen affect the entire body from head to toe in women? And this is a part of what I teach physicians. And what's nice about physicians who go through this type of training, they actually see this for themselves in the clinic, what happens to their patients. Before starting hormone therapy, my patients have heart palpitations, hot flashes, shortness of breath, no energy. But when I give them estrogen, these things go away. So I tell physicians, you'll see for yourself. And after a while, you'll understand that, and they end up changing their practices because a doctor has a hard time managing the symptoms of estrogen deficiency, what they've spent years doing. And then they realize, if I can just give my patients enough estrogen, these conditions just don't exist, mental illness conditions, or these types of physical conditions that women are told. So we find that blood pressure comes down, cholesterol comes down, because estrogen regulates absolutely everything in the female body, right down to the core of every cell.
How can we as women, when we go to the doctor, advocate for ourselves? I mean, we don't know. I mean, you could go in there and spin them around because you know.
Yeah. And I usually get kicked out, dismissed. Don't reschedule.
How can we advocate for ourselves? Yeah.
And that's happened to me before, because I've challenged doctors. It's like, okay, you want to take me off of estrogen? Why? How many patients have you had? I'm telling you, doctor, that I don't get depression as long as I maintain my estrogen. I don't get the same symptoms as other menopausal women or perimenopausal women as long as I'm on estrogen. And you're trying to talk me off of this because estrogen, now you're going to write me half a dozen to a dozen different medications to manage all the things that my brain and body are going to experience. The thing is, and the reason why I'm out doing your podcast is to educate women that you have to find good doctors. Don't settle for your conventional doctor. They don't teach in medical school estrogen restoration. They teach doctors to be afraid of estrogen. And as long as doctors have estrogen, they won't prescribe it. And women won't take it because everybody's afraid of it. But I have to, just to put things into perspective, young women have the highest levels of estrogen than any other time of their life in their 20s, early 20s, and to late 20s. Well, if estrogen caused cancer, that would be the highest rate of cancer age right there. But it's not until women are in their 50s when their estrogen tank is empty that makes them cancer and these other diseases that we're told that now we have to live with. So women need to find doctors who have been trained and have some experience prescribing estrogen and progesterone at therapeutic doses that help regulate the menstrual cycle. So if your doctor doesn't have experience using therapeutic rhythmic HRT to restore a healthy menstrual cycle, whether a woman has a uterus or not, then you're probably going to get a low dose protocol. And because, though it's some estrogen, but women will find, well, I'm on the patch. I felt good when I started, but it stopped working. Well, it stopped working because your brain and body need more than what that patch.
Right.
So now you need to look for a doctor who has educated beyond the patch. That's what I train physicians to do. So I work with physicians out of my clinic. I have an online hormone clinic called the Longevity and Happiness Clinic, because that's what happens. You actually increase the quality of your life and the length of your life and increase your happiness when you restore hormones at therapeutic levels and keep them there. So women can actually choose where they are in their reproductive lifespan till death. Yeah, I can never imagine getting off of my hormones. I can tell when my estrogen is low. And once women get enough of the right hormones, they will never go back. You give a woman plenty of estrogen, she will fight you to the bitter end to take her hormones away, because it's life changing, not only for the woman. I mean, really, everybody benefits when my hormones are balanced. My children, my significant other, my coworkers, my colleagues, the girl at the SNS produce, the woman at Chief Produce.
The mailman.
Because my interactions with my world is different. My pets, everybody benefits when I have enough hormones. And so I encourage women, really, and that's why I offer a free hormone coaching session on my website. It's like, if you want to know more information and what's right for you or where you should go, just reach out, because there aren't a whole lot of physicians in it. But I plan to change that. My goal is to change the way we look at menopause and perimenopause, that these are choices that women can actually choose whether they experience these conditions or not. And they just need to find good practitioners who have been trained and seasoned in full hormone restoration, not just these low dose therapies that shut women up for a while. And then it's like, okay, well, I have you on hormone therapy. See, it's not working for you. Now take these psychotropic drugs to manage the symptoms that otherwise wouldn't exist. If I trained myself how to fully restore your estrogen, we would live in a different world if women got enough of the right hormones. Completely.
But we wouldn't have so much joint replacement because,
everybody, because when mama's happy, everybody's happy.
Yeah, because it affects your bones, deterioration of the bones, all kind of things happen to you.
Estrogen denses up those bones. In fact, that's probably the thing that opened my eyes the most is when I started taking bone density scans once every 6 months. And then you see, before the patient starts on hormone therapy, and then the bones dense right up, and it is just like, this is just, and I encourage physicians, monitor yourself. Don't take my word for it. Take a clinical indicator assessment the morning of every blood draw once every 4 months. See for yourself what happens to your own patients. It's not rocket science. It's not like it just works for some women and not others. So, and this is what I train in the physician training. So, and that's my mission now, is to train as many physicians as I can.
Yes.
How to do this. Don't just settle for reading the package insert on how to slap a patch on a patient and then write psychotropic drug cocktails for her when the hormones stop working. Give women the right amount of the right hormones so you can give her brain and body back, because everybody benefits when women's hormones are fully restored.
But I think technically this should probably start even in educating women before they reach it. These young women that are in their 30s, 20s and all that, they're the ones that we probably should target for them to know what can be done, and what are the expectation.
Exactly, Lorna. We need to get the word out so that women know, listen, when you've made the decision that having children is over, you've had plenty, or you've chosen not to have any, this is the time to start. When the hormones are in the beginning stages of decline, don't wait until the estrogen tank is empty or the progesterone tank is empty. Restore these two main sex hormones that need to be looked at as one main sex hormone that helps regulate all the processes in the female body. This is how we maintain this hormonal balance for life. Don't settle. Perimenopause is something that can be avoided. And the more women that understand that you actually can control this, this is controllable. You want to talk about empowering women. This is the true female empowerment cocktail right here, is restoring estrogen and progesterone that helps regulate this, an incident-free menstrual cycle, whether a woman has a uterus or not, because a period bleed is different than a menstrual cycle. And you can still regulate a healthy menstrual cycle in women without a uterus. I eventually ended up having a hysterectomy for other reasons, but I still have a menstrual cycle. But when I don't take my estrogen and progesterone in a rhythmic fashion, I don't regulate that menstrual cycle. So it's, if women really wanted to stay strong and keep her brain and body and her wits about her, she'd find a way to get herself enough of the right hormones for life. And it really does take knowing where to go and change this. So I encourage your listeners, if they have questions, just book a free consultation with me. It's what I'm talking about is not for everybody. It's for most, not everybody, but it could be that's what women are looking for, and I can help them get on that right path.
Okay, because the last question I have, we could go on for the whole evening.
Sorry. I know. Yeah, and you had some great questions.
Thank you so much. What advice would you give to women who are hesitant to seek help for their perimenopause and menopause symptoms? Because I'm from the Caribbean, so a lot of people, they just drink some herb tea or do some old wife fable thing to help them overcome. Some of them don't go to the doctor and all of that. So what advice would you give them?
Well, you have to find out what's causing it. And that's the thing, is what's causing these symptoms that they're drinking their tea for. Because you can't drink tea to restore blood circulating estrogen.
Caribbean people, we drink tea for everything.
Yeah. Yes, but I've never seen tea in monitoring blood work once every 4 months.
Bush tea, the one that you like, the mint and some other stuff that you pick in the garden and you dry. Yeah. So
the only for estrogen is to take estrogen.
Mm-hmm.
The body stops producing estrogen. Don't just throw in the towel. Now you've got to give your body what it stops producing, because your body doesn't care where it gets estrogen. It just wants it.
Mm-hmm.
So when the estrogen declines, we'll find a doctor who knows how to restore it and properly.
Right.
And that's the ticket, really.
Right.
So first find out what's causing the hot flashes, and educate yourself. What are the side effects of estrogen deficiency? Well, most women are experiencing those things now, even
right.
And then find a doctor who isn't afraid to prescribe it at therapeutic doses and in a rhythmic manner that allows a woman to regulate a healthy menstrual cycle. Because when you do this, the brain and body are under the impression a woman is in a reproductive prime, and the brain and body try to rebuild itself and preserve itself for as long as those hormones are hovering in that optimal range.
Okay. As I said, we could go on.
It's an exciting topic. I love it.
Absolutely.
It's so empowering for women. And
yes.
I thank you so much for having this platform and educating women on what they can do to fully take control how their brain and bodies function and thrive, because there's really no more powerful agent for women for strength, mental strength and physical strength than estrogen. So thank you.
I thank you, because that was a wealth of information, and so how can my listeners get in touch with you if they want to ask you a question or just to interact with you? How
they
can
go
they
to there's I have two websites. menopausemoxie.com is for women looking for my hormone coaching help. But I also have panaceasciences.com, where I train physicians. So if a physician is listening, if you want to learn how to prescribe hormone therapy that will change the lives of every single female patient in your practice, reach out for a free consultation. We can talk about your practice and what that entails. And then clinical hormone coaches who want to learn how to get trained to help women like I do. So yeah, go to my websites, menopausemoxie.com and panaceasciences.com.
Okay, but what I'll do is take the information and put it in the notes, in the podcast notes, that persons can do that. So this has been an awesome podcast with getting so much nuggets, some beautiful nuggets, golden nuggets, and how to help us as women to be the best that we can be, to help our family to get where they need to go with us, because as you correctly say, when the woman is not able to function properly, to be at her best, everything else is like lagging. So for us to be there for our husbands, for us to be there for our children, for us to be there for our children. How about that?
And really, just so a woman can just be who she really is as a woman.
Yes.
So Yes, and thank you so much, Lorna. I appreciate
Thank
it.
you. Thank you. All right. So have a good evening and we'll touch base. All right. Bye.
Bye now.